My name is Maria. I'm 63 years old. I'm retired. Today I'm having a facelift. I'm having my eyes lifted, and I'm also having my chin, my neck reduced. I'm having the procedure done today, primarily because I'm planning on returning to work. I want to look good. I want to look nice and presentable. I want my face lifted. I want to look young. My daughter found Dr. Cruz. She had a procedure done, and I was so impressed with the work that Dr. Cruz did that I called in for a consultation with Dr. Cruz.
Hi Maria, how are you?
Hi, Dr. Cruz. Nice to meet you.
You knew I was Dr. Cruz?
Yes, I do.
I guess that marquee outside would give it away, huh?
Okay.
Okay. Well, I read on your chart that you're interested in facial rejuvenation.
Yes.
Maria, is there anything in particular that you're interested in?
Nothing in particular. It's my whole face. It seems to have just dropped in the last year.
You're going through normal aging, and I can just see it from here. And what I'd like to do is, if you'll allow me, let me go through a little evaluation. We can see what we can do in order to turn back the hands of time just a little bit. Maria actually is a good candidate for a facelift because of her long facial structure. It's a little bit more difficult to do a facelift on a round face and a little bit easier on one that is more triangular. What I see right off the bat is that your cheek fat, which obviously used to be back up in your cheek, has fallen, and now it's lying just over here. It's over the border of the jawline. So by bringing the cheek fat up, not only do you get more cheeks, but you also define the jawline. So it's kind of a win-win situation. In fact, it's a win-win-win because by bringing the cheek fat up, you also help improve these folds that have started over your lips.
What about my eyes? They are just falling over my eye. I have no eyelid.
The challenges with Maria is that she's waited quite a long time, and the problems she has are pretty significant. She has a lot of excess skin in her upper eyelid. She has a lot of descent of her cheek fat, and she's got a lot of loss of her cheek fat. So the challenge of the surgery is to be bringing all of this up and to accommodate the fact that she doesn't have quite the elasticity that she would have had, say, in her late 40s or early 50s. So by doing facelift, we're going to bring the cheek fat back up. But then what I'd like to do is also to suspend the eyelid up just a little bit, to tighten it a little bit, to give you a little bit of a cant to your eye, so you have more of an almond shape. What I do is I literally put the fat back up and then gently drape the skin back over for a very natural look. Because what you don't want is, the last thing we want is an operated look. Mm-hmm. And then just remove a little of the excess skin. And what I can do is I can steal a little bit of that fat that's causing the puffiness there and actually place it in here. So it's like robbing Peter to pay Paul. So we take a little bit of that fat and put it here right in the tear trough, and we can fill that area out.
Oh, that sounds great. I had a great consultation with Dr. Cruz today, and I've decided to have surgery with Dr. Cruz.
How are you?
Fine. How are you?
Are you excited?
I'm very excited, yes.
A little nervous?
Very.
All right. Well, that's normal. If you weren't nervous, you wouldn't be normal.
Just hit me.
Really?
Yeah.
Okay. Don't let it go. Let it pass. You're in great hands. We're going to take care of you, I promise.
Okay.
Just going to go over a little bit of the procedure like we talked about. So I brought out a picture, and we're going to be doing, of course, your upper eyes.
Mm-hmm.
Actually, I'll look at this. Your upper eyes, and then your lower eyes, and then we're going to be bringing up your cheek fat and then defining your chin. So what I'm going to do is I'm going to put a couple marks on you. And what this is going to tell me is the position in which I have to move the skin. Alrighty, very good. Now you're all drawn. You're nice and purple now. Okay.
Oh yeah. Okay.
All right, we're going to get you going. Don't be nervous.
Okay.
You're in good hands. Okay.
Great.
This is going to go real well.
Yeah, I'm very positive.
All right, very good. So I'll let the anesthesiologist know, and we'll get going.
Okay.
Start with the upper eye right now, and once again, I'm going to make sure that I keep the crease as low as I can so that it doesn't hollow her out, because We don't want to remove anything but skin and a little bit of muscle here. Fat is a beautiful thing in the face. So right now we're opening up the lower lid to get access to the fat, the bags underneath her eyes. Now I've got the lower lid, and I'm going to position it up and in so that I can tighten the lower lid. This will give her a more youthful cant to her eyes as opposed to the hound dog look that you tend to get as you get older. Because a lot of that comes from the lateral aspect of the whole orbital wall just descending. So what I'm doing is actually raising that up. I'm expecting to be able to create the jawline that we talked about and to get the cheeks that we had talked about. She doesn't have a lot of fat, but we elevated what she had back into proper position. And then also we're going to bring her temples up. So we're doing everything we planned on doing. I expect her to have a really good result. All right, we're all done with Maria now. She's on her way to recovery. We're able to get her cheek fat back up and define her jawline and certainly make her eyes more elegant. Everything went exactly as planned.
It's kind of sad. I look at myself back and it's really sad. I could see that I'm not able to wear makeup, eyelash makeup. What an improvement. I feel so lifted and I just look so drawn in these photographs. Yeah, very nice improvement. This picture portrays someone who looks rather sad, and I'm sure I was. If you look at my eyes look terribly sad, and there's no. My cheeks are flat, and they needed this little bit of just pulling back, just to give me that little bit of whatever I have now that I think looks appropriate for a woman who's 65. I like the attention that I get. It's nice. It's fine for me to go out now. I don't have to wear a lot of makeup, and when I do put on makeup, I look really good. I feel like I look really good. What this surgery did for me was it lifted my spirits as well as my face. It just has given me a new outlook in life. I feel like I've turned the clock back at least 5 years. I feel so good. I feel so proud of myself. My neck looks so good. I don't have that patisma that just pop out. And I look in the mirror and I'm so happy with what I see. Dr. Cruz did a wonderful job.
Well, I'm real happy for Maria. When she came to see me, she was interested in taking a few years off of her. She had become very concerned that she was getting old, and unfortunately that's what happens. But Maria has always been an attractive woman, and she felt that she was losing that she was losing the battle with age. And she came to me and she just wanted to take a few years off, and she felt that her eyes were tired and that she wanted her eyes refreshed and an overall refreshed look to her whole face. With an upper and lower blepharoplasty, we were able to give her a more refreshed look, a more elegant look, and we were able to take the excess skin off of her on the lid so that it didn't look like she was tired all the time, and that's what she wanted. The icing on the cake is to have the chemical peel, which Maria had a lot of sun damage, typical of a lot of people who live in Southern California, and by doing the chemical peel we were able to give her skin texture that she hasn't had in 20 years, and it's such a powerful procedure.
I'm so happy I went to Dr. Cruz. Dr. Cruz was more than just a doctor, he was a friend. Shortly after my surgery, he called me not only once but twice at home to see how I was doing, to see if I was depressed or if I was happy, and he was just he was perfect. My aftercare with Dr. Cruz, I just couldn't even put into words. He was just so great. He really was, and he continues to be a good friend.